Albuterol, also known as salbutamol, in bodybuilding, the milder cousin of clenbuterol. Introduction. When people talk about fat burners in bodybuilding, clenbuterol almost always dominates the conversation. But there's another beta-2 agonist that some athletes quietly rely on, albuterol, also known as salbutamol. Originally developed as an asthma medication, it has found its way into the bodybuilding world as a shorter-acting, milder, and often safer alternative to Clen. Micro. Medical use. Primarily prescribed as a bronchodilator for asthma, COPD, and respiratory issues. Pharmacology. Beta-2 adrenergic receptor agonist relaxes airway muscles, improves oxygen uptake, and slightly boosts metabolism. Half-life, roughly 3 to 6 hours, much shorter than clenbuterol's 30 to 36 hours. That shorter half-life makes it more controllable, dose-dependent, and less prone to building up in the system. How bodybuilders use it. Fat loss. Stimulates beta-2 receptors in adipose tissue, increases lipolysis and thermogenesis. Performance. Enhances oxygen uptake, potentially improving endurance and cardiovascular capacity. Clenbuterol substitute. Popular among athletes who cannot tolerate clenbuterol due to excessive anxiety, heart palpitations, or insomnia. Most commonly seen in physique competitors cutting down before shows, athletes who need fat loss but want less heart stress than clenbuterol provides. Dosage and administration. Typical bodybuilding dose is 2 to 4 milligram tablets 2 to 3 times daily. Total daily intake is 6 to 12 milligrams. Some use inhaler forms, 100 to 200 micrograms per puff. Very fast absorption, but harder to dose consistently. Cycling strategies. 2 to 3 weeks on, 2 to 3 weeks off to avoid receptor downregulation. Some extend cycles using ketotifen, an antihistamine that helps upregulate beta-2 receptors. Benefits in bodybuilding. Milder side effect profile compared to clenbuterol. Shorter half-life, easier to manage effects and side effects. Can enhance VO2 max and oxygen uptake, improving cardio sessions. Noticeable metabolism boost and increased calorie expenditure. Lower risk of prolonged heart strain compared to clenbuterol. Risks and side effects. Even though albuterol is considered milder, it's still a stimulant with real risks. Heart palpitations, anxiety, restlessness. Elevated blood pressure. Muscle cramps from potassium and magnesium depletion. Sleep disturbance if taken late in the day. Tremors, shakiness, nervous energy. Long-term misuse can still cause cardiac hypertrophy, arrhythmias, and other cardiovascular issues, though the risk appears lower than with Clen. Stacking in bodybuilding. Albuterol is often combined with ketotifen, prevents receptor downregulation during long cycles. Caffeine, synergistic effect on fat burning. Yohimbine, especially effective for stubborn fat areas when insulin is low. Thyroid hormones, T3, T4, used by extreme competitors to push metabolism further. Interestingly, some bodybuilders report that albuterol, especially when stacked with caffeine, provides a more functional training experience than clenbuterol, less heavy on the heart, more energy for cardio and endurance training. Risk reduction strategies. Electrolytes, supplement with potassium and magnesium to reduce cramps. Monitoring, track blood pressure and resting heart rate. Cycle smart. Avoid continuous use longer than 3 to 4 weeks. Timing. Take it earlier in the day to avoid sleep disruption. Scientific findings. Research suggests albuterol enhances fat oxidation and may even have mild anabolic effects on skeletal muscle in some animal studies. Human trials show improvements in aerobic performance and VO2 max, even in non-asthmatic athletes. Long-term effects on the heart remain under-researched in the context of bodybuilding-level dosing. Conclusion: Albuterol may not pack the same punch as Clenbuterol, but that's exactly why some athletes choose it. A gentler, more controllable beta-2 agonist that still delivers fat loss, enhanced performance, and improved endurance. But let's be clear, it's still a prescription drug, and using it outside of medical supervision carries real risks. Just because it's milder doesn't mean it's safe.